We're back here on the platform speaking with Dr. Sparkman Ferguson today, and I am told that there are spas that people attend. We were talking about whitening a while ago, and whitening takes place in some spas.
Correct. As you know, spas have all kinds of services available for people, starting with massages and facials and all kinds of other wonderful body things. And someone got the bright idea one day, well, maybe you can have whitening in there too. Except that they didn't realize that you need a dental license to whiten teeth. And so, and it's happening right now, particularly in Freeport again, where we have these things happening, and we have one or two instances in the capital where individuals pulling people in for whitening. I'm talking about advertising on Facebook, which is what everybody looks at these days, and social media, and they see, you know, someone is doing whitening in this place or that place, and they give you a price, and they tell you to come have your teeth whitened, and you go there, and the first thing you notice, it's not a dental office, and that's when you should walk out. But such persons go through with this thing, not realizing that they are enabling someone in illegal practice. And this is happening in the spas, because the spa has a big umbrella over it. You're in the spa, you know, you're having your nails done, your pedicure, your manicures, your hair, and all the stuff. And then someone says, how about having your teeth whitened? You say, oh, no problem, let's do that too. The people in spas need to know that if you're practicing dentistry without a license, you're breaking in breach of the law, and you're opening up yourself, if you get prosecuted, to fine and imprisonment. Okay.
You, as a dentist operating in the Bahamas, and I believe that you are former president of the Dental Association,
yes.
Yes. You think enough education that you dentists make yourselves available to educate the public? Don't you have a responsibility as an association, as a dental council as well, to better educate and inform our public on matters of oral health?
You're absolutely correct. It is our responsibility, and it's one of our goals. And I don't think there could ever be too much educating. Some of it is going on. We just came at a meeting last night where the new president of the association, Dr. Andre Clark, has an education committee this year. And that was a very, very good sign. But there's a lot of educating going on as persons visit their dentists, but in a bigger, broader sense, the public could use more and more education. You know, once ago, people used to invite dentists to come and speak a lot. They're not inviting us to come to speak. We have to ask to go. And but I assure you and the public that if somebody invites a dentist to come, any dentist, I'm sure we'll be more than happy to come and share with them.
Okay. I promised to talk about the technological advances in your profession. In every profession, I believe that there are new technologies available to the dentist. You know, you have sophisticated ways of doing X-rays and all that sort of thing. What is new on the market?
Well, what is new? What is new in my market, in my office, is that we now, and a lot of dentists in our country, we now have dental imaging. Once ago, we had X-rays for everything, which are tiny little films that are just about 1.5 to 2 inches long. But we now have digital imaging where we shoot a picture of your mouth and we can put it on a screen, a 50-inch screen. And that's a great technology because we can now see a lot more than we used to see. And that is quite an advancement. Every dentist in Nassau does not have that technology yet, but it is the technology of the future. Every dentist will eventually have digital imaging, because that's where the market is going to. And that's one of the it's not a new technology, but it's come to our area.
And don't you work in conjunction with members of the medical profession as well? Aren't there times when people come to you that you would really have to refer them to a medical doctor?
We would have to refer them at times, and at other times we have to have consultation with the physician based on a patient's illness, and have a talk about what to do, what we can do, when can we do that, when would you suggest that we do that, and those consultations are very, 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 very important and very, very necessary.
Especially when you're doing things like root canals, eh?
Particularly when you're doing anything. Anything.
What do you mean anything? I mean, you don't have to consult with my physician if you're doing a simple extraction, or not anything.
If you were medically compromised, perhaps, let's say you were a cancer patient.
Okay.
Let's say that you were a bleeder. Let's say you were a person taking blood thinners. That would require a consultation, because if you're on blood thinners, for example, and you need to remove a tooth, we have to have you off those blood thinners for about 5 days, and only your physician can remove you from the blood thinner.
That is interesting, because there are many people who have various heart diseases, eh? And who might be on blood thinners.
Yes.
They go to the dentist.
Yeah.
They should announce to the dentist that they are on blood thinners before any procedure is done, right?
The dentist should ascertain that from them also. It's two-way street in the history, because that's a key piece of information that you would need to have.
Especially if you're doing an extraction.
Any surgery.
Any surgery.
Correct.
Yes.
Yeah. You would want to know.
Yeah.
And because the entire protocol has just changed.
But
for that patient.
A person coming in for a regular checkup or the cleansing of the teeth, you don't need to go through that and ask them about that kind of thing, eh?
If a person comes in and they appear to be normal, and they present and give you a normal medical history, then there would be no need to go and shake them down, so to speak.
Okay. You know, this root canal thing is very scary, because I have heard of people who have had it, and in addition to that, these implants that I have heard also about. People who work for me and friends of mine who've said to me that they've had these things done. It sounds extremely painful. Do you advise people against root canals?
No.
No?
No.
Anybody can do one?
Anybody meaning any doctor or any patient?
Any patient.
Any patient who needs one, yes, can have one done.
No matter what your medical situation is?
Not barring the fact that you know, the medical protocol must be gone through with, and the patient must be deemed safe to do such a procedure on.
And the other question is, can any dentist do it?
Any general dentist has been trained to do it.
Any general dentist?
That's part of your training while you are in rotation in dental school.
Once you are a trained dentist,
yes,
you can do a root canal.
Absolutely.
You don't have to be a specialist or an orthodontist to do so.
No, but root canal therapy is a specialty.
Yes.
Every general dentist, and this is always an interesting question. Every general dentist has been trained to a certain level to do every discipline in dentistry. In other words, I can do braces also like an orthodontist, but I've got to know my limitation, because when I've got to my limitation, now I need a specialist to take a particular case. And my training makes me know that this case needs to go to Dr. Woodley Thompson or Dr. Barry Russell or an orthodontist, rather than me attempting to do this particular one or that particular one.
I saw a young person recently who said that my mouth is hurting. So I said, what's the problem? I believe my braces are too tight. Shouldn't a dentist know how to tighten braces so that your patient is not in pain and they can function normally on the job?
Yeah, people are different. People are different, and during orthodontic treatment, the orthodontist does a certain amount of adjustments in each visit. And sometimes it's a little a bit uncomfortable for a day or two after an adjustment. But if you take two patients and put them and do the very same thing, you will find that one is uncomfortable and the other one is just having a good time.
Okay.
People are different.
People react to pain differently, eh?
People have different pain thresholds.
Yes.
So that's what you're actually hearing.
Yes, okay. All right. All right. Well, I hope that the Dental Council is able to get to the bottom of all of this improper conduct in our society, where people are taking the law into their own hands, so to speak.
Yeah.
So your public education here again is extremely important here.
Yes.
Okay.
Thank you.
Thank you so very much, Dr. Ferguson, for being here today. You're very kind.
Thank you for having me.
Next time I see you would probably be at another recital. No, I'm only kidding.
Look forward to it.
I'm coming to see you soon.
Okay.
Thank you for watching and listening to our program today. Good evening, everyone.